How often do lymphoma survivors need follow-up care? Imagine finishing treatment and wondering what's next for your health. For lymphoma survivors, follow-up care is a key part of staying healthy and catching any issues early. The schedule really depends on the type of lymphoma, the treatment you had, and your overall health. For those with non-Hodgkin lymphoma, most doctors recommend visits every 3 to 4 months during the first 2 years after treatment. These early months are when the risk of relapse is highest. After that, the visits usually become less frequent, often every 6 months for the next 3 years. Once you reach 5 years out from treatment, some survivors might only need annual checkups, especially if their lymphoma was aggressive. However, if the lymphoma was slow-growing or indolent, some survivors may need ongoing follow-up for many years or even lifelong. Right after treatment ends, your doctor might want to see you every 2 to 3 months. These visits typically include a physical exam, discussions about any new symptoms or side effects, and blood tests. Imaging tests like CORT scans or PET scans are not done routinely unless there are new symptoms or signs that suggest the lymphoma might have returned. This approach helps avoid unnecessary procedures but still keeps a close on your health. Follow-up care is often coordinated between your lymphoma specialist and your primary care doctor. They work together to monitor your recovery, manage any late effects from treatment, and support your overall health. Some clinics also offer remote monitoring options, where you can report symptoms or concerns between scheduled visits. This can be especially helpful for those who live far from medical centers or prefer more flexible check-ins. It's important to remember that there are no strict, one-size-fits-all guidelines for lymphoma follow-up. The exact schedule varies based on your specific situation. Always keep open communication with your healthcare team and report any new symptoms right away. Symptoms like unexplained lumps, fevers, night sweats, or weight loss could be signs of relapse and should be checked promptly. In general, the goal of follow-up care is to detect relapse early, manage any long-term side effects, and support your health as you move forward. While the frequency of visits may decrease over time, some survivors, especially those with slow-growing lymphoma, may need lifelong monitoring. Your healthcare team will help create a personalized plan that fits your needs. Remember, staying engaged with your medical team and reporting any concerns is the best way to maintain your health and well-being after lymphoma treatment.